Dan Williams, Survive Outdoors, and what we're going to be doing today is, allow me to digress. We're going to move away from a little bit of the Survive Outdoors, and this is a response to an individual that basically stated I was lying about the ivermectin. So I got to pull up some really good information here to at least address this issue. Coming up, we're jumping right back into Survive Outdoors. We have two videos coming up. One is going to be assessment of trauma in the outdoors. How do you do it when you're miles away, and what do you do? And the second one is going to be splinting with the SAM splint in the outdoors with a variety of injuries, and I'm waiting for my mock patient to get those videos going. So in the last video, at the very end, I discussed about a very astounding case of ivermectin toxicity. And I get this, I've had probably, I don't know, half a dozen patients in the last 2 months ask me to prescribe ivermectin. One thing I want to tell you all out there is that individuals come to a physician, a PA, an NP to get good health care, appropriate health care. If I give wrong information, I am liable. You can sue me. So what's the motive here? Do I have some ulterior motive to give you false information? Of course not. And I try to treat all of my patients like I would treat my own family members. So I'm passionate about this. This is important. So what is ivermectin? Ivermectin is an anti-parasitic medication that's been used forever. I have prescribed it for individuals with scabies. There are some recent evidence, because it's been so overly prescribed, they're doing tons of research, and they found out that it can be helpful for river blindness in situations where this fly will bite you and give you a parasite, cause blindness, and what has been found is that this ivermectin will work against that. It's also been shown to help with West Nile, not directly but indirectly. And so how that's been shown is they put ivermectin in bird feeders at very low dose. The birds eat the ivermectin. It's totally non-toxic to birds. The mosquitoes then bite the birds, and the mosquitoes die. It's very toxic to mosquitoes. So that is really a nice indirect way to wipe out West Nile, and hopefully that's something that can be implemented. It's important to have that foundational knowledge because we don't have appropriate dosage for ivermectin to work against COVID. All of the research shows it is really not that beneficial, and for it to even be close to beneficial, you're talking about prescribing 10 times the acquired dose or required dose for an anti-parasitic medication, which I talked about briefly. So I'm going to throw some articles up here. One by the FDA, I have it written down here. You're going to see why you should not use ivermectin to treat COVID. That's from the FDA. As another one from USA Today, a man whose wife won a lawsuit to treat her husband with ivermectin died. Now, I deep dove on this, and what I found out is that we're really not sure if he died from ivermectin or did he die from COVID. But this is exactly how the media will basically taint something, let it sway one way or the other, and when you read the article, it sure does seem like the person died from ivermectin, but we don't know. So again, I'm looking at it and I dive into the research and I look at both sides, not just one side. And I implore everyone to do that. Financial Times, poisonings are rising in Americans that are being treated by COVID. Why? They're taking too much. So there are people being treated by COVID, being treated by ivermectin for COVID. And in New Mexico, they have had deaths and increased in their poison control records due to people basically taking way too much of it. Shouldn't be taken to begin with. Then in Seattle, as well as the state of Washington and Oregon, both, it's made the news all over the place. Doctors, PAs, and NPs are getting nailed and investigated for prescribing ivermectin. That's prescribing it off-label. What does that mean? When you prescribe something off-label, it is basically something a drug is approved by the FDA. Through tons of research, we find out what is the proper dosage for infants, children, adults, and we go from there. For example, an off-label drug would be using an eye drop to treat an external otitis media swimmer's ear. Totally fine. But you really can't use an eardrop to treat an eye infection. So individuals are using ivermectin off-label to treat COVID, which is absolutely not wise because they're using 10 times the dose. My patient that I presented was not a lie. It was the honest to God truth. And it was very frightening. So let's go through some recent articles here that I've get through the mail that I've read from reliable medical sources with no investment. No one's getting paid by any third party here. This is Emergency Physicians Monthly in December. And here is a very long article on the debate of ivermectin. This is from the Tennessee Poison Control, September 1st, 2021. Why is ivermectin being misused to treat COVID-19? And how do you treat ivermectin toxicity? Because we're getting a bunch of people that are having toxic effects from it. This is the New England Journal of Medicine, August 2020. Serious ivermectin toxicity among humans. New England Journal of Medicine. British Lancet has one. This is from the Medical Minute, Emergency Medicine. Talks about the amount of ivermectin overdoses. And acute encephalopathy, which is an inflammation of the brain after self-medication of ivermectin in a patient with COVID. Another one. I could have 20, 30 of these easily. In summation, you take anything, you take too much of it, you can have toxic effects. The problem here is this medicine crosses the blood-brain barrier. A hallucinogen crosses the blood-brain barrier. Ivermectin does. It causes altered consciousness, especially when taken at high doses. You could literally overdose on water. There is a diagnosis of water intoxication. So, again, what's my motive? Do I have some motive to, spread false truths and misinformation? No, of course not. Am I making money from this video? Zip. My motive is to give you the truth, and I'm begging you to look at both sides, okay? Deep dive, do your research before you throw something down your mouth. Next time, we're going to be doing the assessment in the outdoors of a trauma patient. We're going to be doing the splinting with the SAM splint at all kinds of injuries. That's coming up. We're jumping back into Survive Outdoors Medicine. Hey guys, thanks for letting me digress. I appreciate it. Keep your eyes on the horizon, your face to the wind, and keep the hands out of the ivermectin jar. Take care.